Joining us live tonight for more perspective on the situation is Mary Mayhew. She is the president and CEO of the Florida Hospital Association. Thanks for joining us on Prime tonight. You've said this current surge is dramatically different. Before it was the elderly and people with pre-existing conditions. Now we're seeing young people who have been thought to be less susceptible. Tell us what's going on here in the ICUs.
Well, absolutely. And it's that dramatic increase. So in the span of 30 days, we went from 2,000 cases to now over 12,000 cases. Last summer, where we reached our highest peak, it took us 60 days to go from 2,000 cases to over 10,000 cases. So rapid increase. And then, as has been described, a much younger population. We have healthy 25-year-olds in the hospital, in the ICU, on ventilators. For over a year, these young individuals in their 20s and 30s have heard that COVID was most at risk for our elderly. That is not true with the Delta variant. It is putting young, healthy individuals into the hospitals.
And you just mentioned it, the Florida Hospital Association reporting more than 10,000 COVID-19 hospitalizations. That is the most statewide during any point in the pandemic. So how are hospitals handling the strain? We just saw some reporting from Brian Enton, but what does this mean for other people who need an ICU bed?
It's true. And again, we're over 12,000 hospitalizations today for COVID, but it is that combined pressure. We have both that rapid increase in COVID hospitalizations, but we also have very ill and significant volumes of other patients. So it's that combined pressure and then a staffing shortage. There is a national healthcare staffing shortage. It was acute before the pandemic. It's been only exacerbated by the pandemic. We can expand to have more beds, but ultimately we've got to have nurses and doctors and respiratory therapists at those beds. But hospitals are converting cafeterias, auditoriums, boardrooms to accommodate patient demand. Hospitals are very sophisticated in their surge planning and maximizing every square inch of their facility to meet this current demand.
I want to get your take on the state response. You were formerly in Governor Ron DeSantis' administration. He has said that the surge is seasonal because people are staying inside to keep cool. Florida, of course, has one of the least restrictive policies in the country, and he's even ordered schools not to impose mask mandates. That has worked well. That policy has worked well when it comes to the economics of the state, but is it worth the toll on healthcare workers?
So first of all, what we're focused on right now is the importance of vaccines. What we know is that is keeping individuals out of the hospitals. Of those who are hospitalized today for COVID, 90% are unvaccinated. So we have got to make sure that we are raising our voices, getting younger people to understand that they are at risk from this Delta variant. The governor has been out there focused on vaccines. In fact, because the governor was so focused on getting our elderly vaccinated, our transfers from nursing homes with COVID is less than 3%. But again, much younger population, unvaccinated. We need to stay focused on that. Throughout the pandemic, we have certainly talked about making sure that you're careful in large crowds, that you are washing your hands, that you are wearing masks as appropriate. This virus, we have learned something new about almost every day. And here we are now with this Delta variant that we are all struggling to understand and learn about in a very short period of time.
But a lot of school-age students are not eligible for the vaccine right now. And so prohibiting masks, is that a good idea?
So I'm not going to comment on the school mask policy. What I'm going to focus on is who we are seeing in the hospital, what that means in terms of getting vaccinated, what our hospitals are doing to respond, to keep people safe, to be able to have enough capacity in the system to respond to this demand. Florida has done a phenomenal job responding, making sure that capacity was available in the system to meet the demand, to ensure that during the early phase of the pandemic, our elderly were protected. We've got to get younger people vaccinated.
All right, Mary Mayhew, we appreciate your time tonight. Thank you.
Thank you.